Good morning, everyone. I'm Dr. Venice Barhoum, a dermatologist in Germany, and today we are talking about a subject that people take intense interest in, which is hair loss. What exactly causes it, the best treatments, and some really great tips in order to achieve healthy and full hair. There are many types of hair loss, and we'll talk about the most common ones. Male and female pattern hair loss is a gradual thinning on top of head, affecting people as they age. This is the most common type of hair loss. In men, hair often begins to recede at the hairline on the forehead or on top of head. Women usually experience hair thinning where they part their hair. Alopecia areata means losing hair in patchy bald spots. Is believed to be an autoimmune disease where the hair follicles are never destroyed. All hair can grow back without treatment at any time. Hair loss due to a physical or emotional shock usually causes overall hair thinning but is temporary. Traction alopecia means hair loss caused by tightly tied back hairstyles or braids. This prolonged pulling on the hair follicles may destroy them and lead to permanent hair loss. Hair loss after giving birth. Pregnant women usually find their hair wonderfully dense. The cause is probably the growth promoting environment in the body of pregnant women. With birth, all the hairs which have been due for months end their growth phase and shed at the same time. This hair loss is noticed 2 to 4 months after giving birth. It's self-limiting and only requires explanation. Hormonal changes and medical conditions such as menopause, iron deficiency, thyroid problems, or maybe type 2 diabetes can also lead to hair loss. I would always recommend running a bunch of blood tests in order to rule out any underlying medical condition. Scalp infections and a hair pulling disorder where the person is pulling out his own hair can also lead to hair loss, which can be permanent sometimes. Hair loss can also be a side effect of certain drugs or due to chemotherapy or radiation of the head region. These tips may help you avoid preventable types of hair loss. Be gentle with your hair. Use a detangler and avoid tucking when brushing your hair. Avoid harsh treatments such as hot rollers and curling irons. And limit tension on hair from hairstyles which may use braids or rubber bands. Ask your doctor about medications you take which may cause hair loss. Protect your hair from sunlight and stop smoking. Some studies show an association between smoking and baldness in men. Today's subject is about treating the most common type of hair loss, which is androgen-related alopecia, also known as male and female pattern hair loss. There are many accelerators on hair growth, and the first one I really want to underscore is blood flow itself, which equals to the delivery of nutrients and oxygen to the hair follicles. This explains a lot of the treatment of reversing hair loss. Minoxidil or Rogaine is a medication which allows more blood flow to the hair follicles by expanding the blood vessels. It comes in an oral and a topical form. It's a 5% solution which can be found as a liquid or a foam. It's important to use it twice a day, and you need to do this treatment for the rest of your life if you want to hold on to the hair growth that you obtained with minoxidil. As an oral medication, it has side effects and can cause headaches, dizziness, and reduction in sex drive. And the really key thing here is to get that dosage right in order not to have such side effects. Now, massaging the scalp and putting red light on the scalp can also promote hair growth through increasing blood flow to the hair follicles. Now, let's talk about the use of PRP or platelet-rich plasma. The purpose or the basis of PRP is to encourage nutrient delivery to the scalp using somebody's own platelets because those platelets are enriched for various nutrients. It's also the case that PRP injections also help promoting hair growth through mechanical stimulation of the hair follicles. Microneedling also stimulates more hair growth by increasing blood flow to the scalp, or sometimes even inflammation through those needles just enough at the local site, which helps activate the stem cells population of the hair follicles and promote hair growth. Now, Botox injections can really help to treat hair loss by relieving tension of the scalp. That allows more blood flow to the hair follicles. It's important to know that Botox eventually wear off. That's why those injections have to be done repeatedly. Finasteride is a prescription drug which have been shown to increase hair number and thickness. Some patients also experience a slowing of hair loss with finasteride. It comes as an oral and a topical form but can cause various side effects like reduction in sexual drive and function as well as overall drive and motivation. This is also a long-term treatment. Now, sufficient biotin, zinc, and iron levels are really important in order to maintain proper hair growth. And if your blood levels are low, you may have to supplement them. Nutrafil is an over-the-counter supplement which contains zinc, biotin, and many vitamins, including vitamin D. In Germany, we have aminocarine capsules which have biotin, zinc, calcium, iron, and many vitamins as well. Now, regular exercise and having normal body fat percentage are really very important because being obese, being overweight, or even having type 2 diabetes can indeed lead to hair loss. There are a few over-the-counter supplements such as myoinositol, which improves blood sugar levels and thus aids sleep in some really great ways as well. Metformin also dramatically reduces blood sugar levels, so you need to take it with carbohydrates. This medication is usually given to patients with type 2 diabetes but can also help treating hair loss. Now, applying topical caffeine cream, shampoo, or ointment to the scalp can also help increasing hair growth. And I think it's really very important to mention caffeine as a treatment because of the low incidence of side effects, the general safety margin, and the essentially comparable efficacy with minoxidil. Topical caffeine shouldn't necessarily be applied daily in order to maintain hair growth, so this is a treatment that you only need to do 3 times a week. Examples are Alpecin caffeine shampoo and Biohatin caffeine shampoo. You need to rely on the application of caffeine topically because consuming or drinking more caffeine doesn't accomplish the goal of offsetting hair loss. Ketoconazole or Nizoral shampoo is an antifungal medication which helps to treat any sort of inflammation on the scalp that may contribute to hair loss. It has been also shown to be effective in increasing hair number and diameter. The use of ketoconazole shampoo 2 to 4 times per week with a scalp contact time of 3 to 5 minutes has been shown to be helpful in maintaining hair that otherwise be lost. That was today everything about hair loss. I hope you guys found it helpful for you. If you have any question, please leave me a comment. I would be very happy to answer your questions.